We're good. All right. Hey, folks, can we go ahead and get your seats? We're going to go ahead and get started. Dr. Gupta. Dr. Gupta, if I could have you step out, please. All right, folks, we're going to go ahead and start the next session. This one is near and dear to my heart, only because of the gentleman to my left has spoken at our conferences in the past, not only this particular conference, but also the Florida Industrial Hemp Conference that we run. Dr. Jeff Konin is one of those individuals that I don't know how to express how entertaining he is and how knowledgeable he is in the realm of cannabis and the subject of sports. We did a whole conference last year, so I don't know if any of you all actually attended, but we did a whole conference on this subject, just like this one, but it was all on cannabis and sports. So we covered the vast majority of subject matter. This is going to kind of be a mini conference. It's a little mini session. I call it the Jeff and Corey show because these two guys are going to team up and give us a wealth of information of what's going on in the world of sports, not only from the collegiate level, but also from the professional level. So without further ado, Dr. Konin, I'm going to turn it over to you and let you drive this show.
Great. Thanks, Gene. No pressure to entertain after that, right? How's everybody doing today? Awesome. So yeah, so we're gonna branch off into a whole different area over the next 1 to 2 hours. And myself and my partner in crime, Corey Tremble. Corey, we'll introduce him after my presentation. He's with the Detroit Tigers and works out of Lakeland, right up the road. And I work at Florida International University. I work mostly with collegiate athletes. Corey works mostly with professional baseball players. And this is an interesting dynamic of how we're going to present this, because oftentimes in celebrityism, if you will, and sport, what happens at that level influences and trickles down to the behavior of others. And the topic of cannabis, for the longest time, it's been the other way around. It's not infiltrated college and professional athletics, at least from a legal perspective or from a non-drug testing perspective. And now we're slowly starting to see the policies loosen. And I'm not going to go as far as to say it's being accepted, but what we're going to do for you this afternoon is lay out the landscape. Whoops. And the first thing is never spill water on yourself at a podium, which I just did. Okay, so let's take a ride together. Goals that I have in this presentation. I'm going to focus on the college setting, college athletics, different divisions. I'm going to explain the body that oversees college athletics. Many of you know the NCAA, National Collegiate Athletic Association, where they are with policy, because the policy they set essentially drives what we can or can't do with college athletes. And I'm going to share with you additional stakeholders. So when I'm at a university, who are the people that are involved in the decision-making of the testing, the use of, the disuse of, everything from THC products to CBD and all of the other cannabinoids. And then what I'm going to do is take you on a walk through what really happens behind the scenes, the doors that most average sports fans aren't allowed to walk into, and see the locker rooms and see the training rooms and be on the fields and actually talk to the athletes on a daily basis about cannabis. Many people will have a snapshot. You'll see a news story. You might read an article about one athlete telling you something. You might read studies where they surveyed athletes anonymously. I'm going to walk you through what happens when you actually sit down and talk with them. Why do they use? What do they use? When do they use? And what's it doing to their performance that we're learning about? And then I'm going to, at the very end, make some what I call bold predictions. So a little bit about myself. I was talking with somebody earlier that I think in this space being all things cannabis, everybody has a story. How many of you started in your life 16, 17, 18 years old, finishing high school, telling your parents, I'd like to go to college and study marijuana? Anybody? One. I'm going to talk to you afterwards. But most of us didn't. Most of us, something happened in their life that triggered a change. So I say everybody has a story. So I want to tell you briefly about my story because then it will make sense to you. So I was traveling around, for the most part, the country, talking about sports concussions. And I happened to be out in California doing a workshop, a 3-day workshop. And there was a physical therapist in the room. And he asked a question to the whole group. We had about 100 people in the workshop. And he said, in California, as you know, marijuana is freely available anywhere. And he said, if I go to work one day in my clinic and I see on my, my schedule coming up the next day, I have a new patient evaluation for someone with a concussion. Should I call them the day before and ask them not to use any marijuana of any kind so that I can do a good formal baseline concussion evaluation? I can check their memory, I can check their balance, their vision, everything, non-THC influenced. And as the speaker of the workshop, I said, well, I've never been posed that question before, but that sounds really good. It makes good sense, good practice. And then he said, okay, but what about after I start treating this person and 10 days later, they have migraines, anxiety, difficulty falling asleep? Should I encourage them to try a little bit of THC? See if that helps. And this was my story because I had no idea. I didn't know how to answer the question. I hadn't been in this space. And I didn't know if I could legally answer the question because I had no idea. But when I left that weekend and went home and started sort of self-searching, I realized that it's a really relevant 2 questions he asked me that more people should be talking about all over the country. At that time, I think it was almost 6 years ago, there might have been, a handful, dozen plus adult use states, maybe in the mid-20s, medicinal. But if you interpret that, we're over 1/3 of the country had some input relative to this, and every practitioner would be involved. I just happen to be not involved in that space in my world. But then I realized, you know what? There's a lot of people who self-proclaim themselves as concussion experts and are out there doing lectures, but nobody's talking about this in the sports world in my space. So I devoted everything from that point forward to study then all things cannabis with athletes. And when I say all things cannabis, yes, it's THC products, it's the deltas, it's all the other crazy things that you've seen when you go to the shows. It's the other cannabinoids, the minors, it's application, it's dosage, it's vaping, it's whatever else is happening in the collegiate settings that I work with and now I consult in. And since that time now, I've traveled around the world. I just returned from Europe last night. And this has become a fascinating topic to me because of what we know and what we don't know. And as I'm sure all of you in this room know, just by being here, you already know a lot more than most other people when you walk out the door. And I find this in all of my travels when I go speak at conferences. I've had the pleasure of a long career of writing books and lecturing, being a university professor and researcher on various different topics. But in our space in sports medicine, this is untapped. For the longest time, the bottom line was that anything labeled marijuana was banned. And we drug test in our university athletes. And if you test positive, then, depending on the old rules, there were strikes and penalties and suspensions and all these things thrown out of school. And those rules have changed. So let me ask you this. If you had a policy where it's 3 strikes, you're out, next year you come back to the same university and they have a 5-strike policy. Why did that happen? And if the suspension no longer is a year, but a game, why did we change that? Why did we become more lenient in policy? Is it an acceptance greater now with the generation coming up? Or is it because the person who tested positive on the 3rd strike was the best player on our team? I submit the latter, which is probably the truth. These are my disclosures in the last couple of years, and this is current right now. I am a consultant with the University of Georgia, year-round retained, University of Alabama, Clemson. I just signed with LSU. I haven't had a chance to put them on there. Worked with Michigan, Duke, and a number of other schools, because these universities have started to realize, again, actually the experts they have in sports medicine have no expertise in this space. They don't know how to advise or educate the athletes because they're not up to speed themselves. And quite frankly, they have enough things to do, so they don't really get up to speed in here. Bring me in, I speak with the athletes, I speak with the coaches, and it's been an amazing experience. It's taken me through these places, as I just shared with you, with some of them. I work with the Women's Tennis Association as well. I've had a chance to go to Wimbledon and the French Open, and I've been on the sidelines of Alabama games and in Cameron Indoor Stadium and the Michigan and all these crazy places because of my story, because I decided to learn about cannabis. And I have to tell you, if you find me someone who lives a better life than I do, introduce them to me, because this has been fascinating. When I show up places, I've been the brunt of every joke you can possibly imagine. I went low key today. I have many friends in this room. I know a lot of you here. It was really great to see you when I walked in. I only wore my 24-karat gold lapel, but I have belt buckles and I have socks and I have everything else you can think of, because depending on the conference you go to, you have to play the part and dress the role, right? So now when I show up these meetings, literally I walk in, here's the weed guy, right? And that's okay. And that's a real suit. I also started my company, which is called Ph.D. 420, Dr. Cannabis. You got to have some fun with this, right? I mean, I take it seriously. I'm a professor. I do research. I educate and teach in a doctoral program, but you got to have fun with this stuff. And I'm not kidding you. Probably every 3rd or 4th trip I go to and I check into the hotel, they give me room 420. Can't make this up. I really can't make this up. So I basically think it was meant to be. It just took, I'm 57. It took a little while in my life to find where I'm supposed to be, but I think I'm here and I've arrived. So I want to talk to you a little bit about this. When I work at a university setting, it's not just, does the athlete want to use something for pain, inflammation, anxiety, sleep. Those are the top 4 things that we look at, but it's their coaches. It's their head coaches. It's their assistant coaches. Think about this. When I was first called by the University of Alabama, my presentation, my approach, every word out of my mouth was vetted 6 times virtually when I presented to them. 6 times. Jeff, show us what you're going to say to our team when you come here. It's Coach Saban's team. He controls the whole message of this team. Okay, here's my presentation. Okay, can you change this word, change that word, change this slide, don't do this and add that. No problem. Present it again. And you go through a different level of stakeholders, many of them you see on here, for approvals. The final approval is you go to Tuscaloosa and you sit in a boardroom that's connected to Coach's office, and it's just you and Coach Saban and the one person who's director of sports medicine that brought me in. And you present this presentation to Coach Saban. This is what I'm going to say to your team. And then you do that with Kirby Smart, you do it with Jim Harbaugh, and you do it with all these other coaches, because ultimately they have to approve the message that you're sending to their players. This is very, very different. In the collegiate environment, a head coach of a sport controls all aspects of all messages to the team. It's really critically important to understand that. There's a leadership team. Those coaches report to athletic directors. The athletic directors want to know, what is the message that we're having internally in our group? Because at some point, this might get out in the media if there's a bad situation. And so if they say, well, this person just got into an automobile accident and they had tested for marijuana in their system, so they were driving under the influence. Well, someone wants to come out at the press conference and say, you know what, it's unfortunate because we do marijuana education. We bring in an expert from the outside and here's how we laid out. So everyone has that plan. So it's all choreographed. It's not just an accident that I show up and say what I want on a slide. It's choreographed with a message that's controlled. Same thing with our sports performance teams, all the strength coaches, all the sports nutritionists, now mental health is on staff. And you can see the list goes on and on and on. I talked to academic advising. You know, academic advising is taught, well, what are the warning signs when we see that we should talk to somebody that maybe this person's using too much marijuana as a college student and a student athlete? And I speak to them and I say, well, are your warning signs that their grades are going down? Are your warning signs that maybe they failed a class? And they'll say, yes, yes, yes. And I said, well, you know, a lot of people do that. I mean, my grades went down. I failed classes because I don't like the topic. I don't like the teacher, whatever. You can't just assume everyone's using marijuana and abusing it because of those things. So we try to become more contemporary and understand, more importantly, in this group of all these stakeholders, to get people on the same page and to speak to the athletes and understand. Because technically right now, the majority of the athletes that use, and a large percentage do use. And I'm going to tell you this. If I were to ask you, of all sports in a college setting, which teams do you think use marijuana the most? I'm just going to speak for you. And you're going to say football and basketball. And I'm going to tell you, it's tennis, it's golf, it's diving, it's equestrian. There is no line drawn between users and non-users. There are backgrounds that people come from that make them, you know, more interested in using. But this is not just a certain population of individuals. And that's why it's important that we speak to everybody in the organization with the same message. I've also heard people tell me, well, we don't need you to come to our school, Jeff, because in our state, it's not legal. So you're telling me your athletes don't have access to this? Really? Which is laughable. I grew up in New York and Connecticut, and our drinking age was 21. And you could drive 15 minutes up I-91 over the line into Massachusetts and Vermont, where drinking age was 18. What do you think you could find off the first exit? A liquor store, the biggest liquor store in the entire state there. And so the bottom line is you can find access, and everybody knows this, legally or illegally. But what I want to share with you what's happening right now on the collegiate forefront is leadership, like I just described, is, in my opinion, foreseen in one of three ways. So in the last 5 years, primarily doing marijuana consulting with college athletes, I've learned three things about program leadership. Number one, there are some programs that make things happen. It's not accident that Alabama and Georgia and Michigan and Duke are winners. All right, it's 14 minutes and 58 seconds. I was waiting to see how long Dr. Barry was going to yell something at me. Ohio State will not hire me, so. Anyways, these programs have leaders because they realize they don't know everything and they don't want to leave anything unturned. They want to address every possible issue. And they say, if there's a reason why anyone in our program is vaping, using THC, whatever it is, and that's impairing their performance, and that's impairing our team performance, we want to know and we want to be better. It's as simple as that. Those are the programs that I say like to make things happen. I'm very fortunate to work with a number of them. There are programs that watch things happen. What does that mean? It means that they might bring me in and they might ask me to do a presentation to their players, but they're not ready to change yet. They want to watch what the Alabamas and the Georgias and the others are doing and see how that turns out for them. And I have to warn them, you can pay me as much as you want to come in and do a presentation. I will happily take your money and I will give you the best TED Talk you ever heard. but it won't change your culture. As soon as I walk out of the room, nothing's going to change with behavior. It takes a while. It takes relationships. It takes trust to change behavior. And most importantly, what I've learned, it takes open and honest education. The players have not been openly and honestly educated with. They've just been told, don't do this, it's bad. Well, if the people advising you and taking care of your health just tell you don't do it, it's bad, and that's their only message, you're not going to go to them and educate yourself. You're not going to say, what's the best dosage for this? What time of night should I use this? How should I apply it? It's never going to happen. So they're learning from each other. They're learning from Lord knows where. And then there's programs that wonder what happened. These are the programs that I talk to, and they say, and I quote, Jeff, we don't have a marijuana issue on our campus because I do all the drug testing, and I've only caught 2 people in the last 15 years. You know what that means? They all know how to beat the test. They know exactly how to beat the test. And they have no idea that that's even happening before their eyes. So this is the landscape that I work in. And what's happening now is there's been a complete shift. And Corey will talk about it in pro sports in the college setting. There's just been a simple shift away from penalizing people. And as I tell you earlier, this is really from 2 reasons. One was the literature does not support any aspect of any cannabinoid as a performance enhancing substance. It can get us to a balance, but not performance enhancing, not like blood doping, for example, or steroids. And so because of that, it's not designed to create an unfair playing advantage, which is what most banned substances are by NCAA. In addition, the message has been shifted towards, well, let's just talk about this. Instead of using the term catching marijuana in their system, let's just talk about identifying marijuana in their system. And if we identify it, what does that really mean? Does it mean that this person tests positive and then therefore we send them down the hallway to the 3rd door down on the right to sit on the couch with a counselor who's going to tell them why it's bad? And they have 1 strike, and the next time they test, we send them down to the couch for the 2nd time, and so on and so forth. And what people have realized over time, that approach didn't work. The punitive approach did not work. It did not change behavior. But more importantly, no one ever figured out, well, what does it really mean if they have this amount of THC in their system? Nobody answered that question. This has absolutely nothing to do with my slide, but I love it, or my presentation, but I love it. It's true. So this is the shift. In the sports world for the last however long, marijuana bad. It's simple, period. Don't do it. Our jobs in sports medicine was really easy. There was no education. There was no advice. It was don't do it. If you do it, you test positive, you're suspended. It was simple. And now it's changing. Now the question we're asking is, are there therapeutic benefits? Truly at what doses? And the reason why we can ask these questions and what are the risks is twofold. We're talking more about it. And in the college setting, we measure everything. We have wearable technologies. We have software programs. We measure everything. And so I ask every program, the first time I meet with them and I show up on campus, I said, I want your leadership to be prepared. When I show up and we sit around a table and talk about how the next day or 2 or 3 is going to go, you be prepared to tell me why you drug test. When you drug test people, whether it's randomized, you have a series of planned drug tests, how you drug test, what threshold level you test at, why do you do it? And when someone comes back with a test that says there's 45 nanograms per milliliter in it, and this person has 300 nanograms per milliliter, what is the difference and what does it mean? What do you do with those numbers? Why do you test? This is what I'm asking every college setting right now. Understand, I'm not asking them to do away with testing. I want them to test, and I'll show you why I want them to test. So a couple of years ago, and it was at one of Gene's conferences, which by the way, I'm so appreciative to Gene and Dana for putting these shows on and doing what they do to help this industry move forward and find answers and solutions and hopefully help the patients. A number of years ago, I think we were in Fort Myers maybe, and I presented this where we wrote a white paper to the NCAA. It was myself and a number of the directors of sports medicine from these, what we call Power 5 schools, some of the big name schools, particularly in college football. And it was Georgia and Alabama and Oklahoma and Michigan and West Virginia and Clemson. And let me tell you why this happened. Because after the national championship game in football between Georgia and Alabama, when the game was over, they drug tested randomly some players from both teams. And they took them, the minute the game was over, the drug testers find them on the field and they escort them away from everybody and everything to provide a urine sample. And it took each of those players from both teams hours, wee hours into the night. Championship games on a Monday night. They were there, I don't remember, they told me 3, 4 in the morning providing samples. But think about this. The team that won, those players, this was Georgia, they couldn't celebrate with their players in the locker room. They're waiting to provide a urine sample. The team that lost, especially the seniors that were randomly tested, they couldn't spend their last game as an athlete in the locker room with their teammates to console. And neither team could leave the venue because they all go on the same buses back. So both teams were stuck there for hours. And the bottom line was the leaders from Georgia and Alabama got together with a number of us and said, we need help. We need to ask them, like, change the policies, change the rules. And so that's what happened. They changed rules. And the NCAA basically came out and said, okay, we're not going to test anymore only under certain championship ways and certain settings. And we're going to change the penalties. We're not going to penalize people anymore. So you guys can keep testing them in-house if you want, and you can create your own penalty system up, and you can create your own threshold. Every college in the country right now that does their own drug testing can create their own policy. Some can have a 0 tolerance. Some can have 150 nanogram as a positive test. Some could have 10 strikes. Some could have no strikes and just test everybody monthly and just look at trends and educate the athlete. They can do whatever they want. And that's where I come in and advise with them. I don't tell them how to do a policy. There is no one best policy, but help me understand why you test. Why do you care if marijuana is in an athlete's system? Do you want to know if they use CBD lotion as a topical, which is, by the way, banned by the NCAA? Still, all cannabinoids banned, one sentence in their handbook. So they came out one night. We literally woke up, no response to our letters, but we woke up one day with this memo on the internet that said, we're changing our policies. We're no longer testing and we're raising our threshold. Now, at the time, the threshold was 35 nanograms. You had 35 nanograms in your system, you test positive as a penalty. They raised it to 150. Well, when you tell the athletes this, hey guys, a positive test is no longer 35, it's now 150. Come on. You're giving them a license to smoke. And so what questions do you think I get as a consultant now? Hey doc, how much can I put in my system before I get to 150? That defeats the purpose, right? So they came up with this policy that basically said, we will drug test with an NCAA, but only at championship events. And if you test positive at a championship event, it's a warning. You'll only be suspended and penalized if you test positive a second time at a championship event. Come on. Right? But the bottom line is what the NCAA won't come out and do is remove this from the banned list. I mean, we're getting more and more ridiculous with policy from NCAA to the point now where they really aren't an enforcer of this. They've passed it back to the schools, and it's up to the schools to decide how to enforce it. Now, there are some colleges that are faith-based. They have a 0 tolerance policy. There are military colleges, West Point, Naval Academy, Air Force, 0 policy, dude. No questions asked. I promise you those schools have people that use marijuana and know how to beat the drug test, and they are not deterred from being tested in a 0 tolerance policy, losing a role from even the military academies. And so you can see, I know this is a little bit small, but this comes right out of the NCAA handbook, and it basically says all cannabinoids are banned. Simple as that. Now, when they say all cannabinoids are banned, I asked the NCAA, tell me something. When you say CBD is banned, how do you test for CBD? They don't have an answer. So let me fly through here. So this is what I do. This is what I think is really important. This is where I get into educating the athletes in universities. Look at the picture on the left. We take 2 athletes and we drug test them at a university. One of them tests 145 nanograms per milliliter. All this is a snapshot in time, by the way. That day we tested them, this is what it was. That person passed the test if the threshold's 150. They don't have to go down the hallway and sit on the counselor's couch. But their teammate, who's different sized body, they have 155 nanograms and they tested positive. And my message is to them, I really don't care about the policies and the rules and the strikes and all that and the counselors. I care more about what is that number doing in your system, because both you guys or girls, that's about the same amount of THC in both your systems. Is that impacting your ability to perform or not? Simple as that. And I'll promise you this, and the athletes that I meet with, we have technology, we overlap it, we don't see any changes. Whatever they're doing is not impairing their performance. Maybe they could be better, I don't know. And others it is. And I'm going to give you examples of where it is impairing their performance. Now, understand this, when you're working with certain patient populations, you might be able to increase dosage and you might be able to have high levels of nanograms of THC in your system regularly. But those are towards function, ADLs. These are people who I work with that are trying to perform at the highest level. So the question is, does a higher dose actually impair higher performance levels? And the challenge is that this is a group of people we can't study, right? Because whereas THC, it sits on a Schedule 1. And as an institutional researcher, I can't perform a study where I can just simply, take half the athletes on this team and give them heroin and this half placebo. Let's go out and play and see how we do. And it's the same with THC. So a lot of the stuff I'm going to present to you now that we're learning is retrospective analysis, where we drug test players, we see how much nanograms are in our system, and then we overlap it with all the analytics that we have, looking at their balance, their reaction times, their memory recalls, all things involved in their sport, speed, strength. And this is the challenge. You all know better than I do in this room, especially those of your physicians, about low dose and the optimal dose in this dose response curve. And your goal is to ideally reach that, that ideal sweet spot where people are using the least amount they need to get the benefits maximized and symptoms removed. But these athletes don't have guidance, as I alluded to earlier. They self-dose. So for example, I'll talk to them. I say, tell me, what's your mode of application? When do you do this and how much and how often? And they said, well, doc, I just sit in my room at night when I'm studying, I chill, I wind down, I got a vape pen, and this is what I do. And I said, okay, well, how much do you take each night? What do you mean? I just keep vaping, basically. So what they're doing is many of them are overdosing, not in the sense of obviously catastrophic death, but they're using much more than they need to on a regular basis. In addition to that, we have players telling us, you can walk through some locker rooms and just see a cloud of smoke. I found vape pens on sidelines from some of the schools. I've worked with individuals that have had vape pens used at halftimes of games, mostly for anxiety purposes. So the questions we're asking is, are you using it the right time, the right amount, so on and so forth? Because yeah, they know, they're not stupid, these athletes. Some of them will benefit from what they're doing, but they don't know what they're doing. So I'll share with you some things that we've learned. And this is proprietary. You're not going to see me publish this because the schools are using this information as competitive edges, as you can imagine. But we've seen delayed healing in soft tissue injuries. So individuals that have a hamstring strain, a quad strain, that might heal typically in 5-7 days, taking a little bit longer when they have high amounts of THC in their system. Reconstructive surgeries like an ACL, knee injury reconstruction, that could, take 6 to however many months to heal, could potentially take longer. We're seeing diminished oxygenated blood flow supplies for healing in the patients that we know that we're working with that have high doses of THC in their system. We're now starting to look at concussion recovery and see if this is the case. How do we know this? Well, we have medical records and we have the ability to go back into the drug testing records and overlap these and compare groups that had THC in with those that didn't with similar injuries. Now, granted, injuries are all different, but we're starting to see these types of trends. And so we're able to better advise the athletes. So for example, I can tell them, yeah, if you have this in your system, maybe you're more prone to have a hamstring injury, and I'll show you how that can happen. But more importantly, when you have the hamstring injury, now I need to sit down and counsel you and say, listen, because this is in your system, it's going to slow your healing. So can we not put it in your system right now for X amount of days while we're healing to facilitate this? In fact, we want to flush it out as best we can because it's not helping you with injury recovery. Maybe you felt better with anxiety. Maybe you slept a little better, but right now you can sleep good and not be anxious, but you're not going to play because we can't heal the injury. This is an example. It might be a little difficult to read. This is just one player that I pulled out to show you where this player is at a Power 5 school training with the best of the best. and almost over a 9-month period of time, gained no lean muscle mass and tested very high, but not high enough to fail a drug test. The number was like in the 140s, right? 142 nanograms. Well, we sat down and showed that person the trends that we were seeing testing every month and asked that person to back off what they're using and let's see if we can see a difference. That person backed off, not completely, still tested regularly at an average of 40 something nanograms over the next couple of months, and ironically started putting on lean muscle mass. This is not uncommon of what we're seeing in our athletes with high amounts of THC in their system. And the only denominator that was different was use. In other words, they're performing the same way everyone else in the team is when they come in. They've set goals in the weight room with them. And this is what we're seeing when they have high use in their system that's too high. Ironically, the person was functioning just fine when they averaged 46 afterwards. They said they felt great as well. They're just putting too much in. They didn't need that much in. As I mentioned earlier, you can pull up all the literature you want that's peer reviewed. There's not one thing in there that shows a benefit in performance. When I say performance, measurable speed, reaction, cardiovascular, all those types of things. I'm not saying it doesn't exist. Just because it's not published doesn't mean it doesn't exist yet. We haven't found it, but what's published right now, and I'll also put a disclaimer there, a lot of these studies aren't great. The methodology is poorly done, and it's understandable. It's very hard to study this, as we've mentioned. But these are the things that we're seeing that resonate with the athletes. We don't tell them don't use marijuana, it's bad. It's going to impair performance, but how does it impair your performance? We have to speak to their identity. An athlete's identity is their sport. If it's a swimmer, their identity is the speed at which they go off the block when the gun goes off and the time at which they get from one wall to the other wall. So we have to explain to them, reaction time can be impaired, and this is how, and we show them this. If it's a football player, your reaction time is impaired, your memory recall, you forget plays and coverages, you're going to get more motion penalties, lots of different things can happen. So we use words that make sense to them. Other things that we've seen. We talked to them about hyperemesis. Hyperemesis is a real thing. And what we're seeing in the collegiate athletes is a frequent user, mostly through vaping or direct inhalation of some kind, is the day before they have a precursor. And they'll feel a little nauseous, maybe come in with a stomach ache. In the past, they'd come in and we say, hey, go take 2 Tums and go away. Now they're coming in, they have no abdominal rigidity, nothing else that they can explain. And the next day they go out to a practice. And within the first 10 to 15 minutes of the practice, they start to throw up uncontrollably. There's no exertion yet. It's not summer 95 degrees. They're not overweight. It's not the end of a 2.5-hour practice. This has been THC induced. We don't really understand, for those of you who study this, we don't know the triggers, the etiology. We've seen this in both new users, frequent users, but we educate them now that we know what this is. It's really, really important because in the past, they wouldn't know. But now we talk to all the players and we say, look, guys, you know who uses and who doesn't, and what amounts, and who's got it under control. But when you got one of your players who's one of the best conditioned athletes in this country, they just randomly go out there and get sick and start throwing up. And the one thing we know it's different is their users. And they're much more aware of this right now. So this should have volume on here. If I click it next, it should roll the video. Hopefully it's embedded in here, and just enjoy this.
Charleston Southern and NC State opened up their season, and this dude on NC State, number 0, has no idea that in a couple minutes he's about to get puked on. Let's roll the tape, see how it breaks down. Number 1 on Southern, he has the ball. 0 on NC State. He's going to pick number 2. He's going to run number 1 down the court. Now, is this the culprit? I don't know. Could have been, some bad shrimp. What was the spread before the game? Who knows? But he got a little tired there, and now Southern's going to miss that layup, and then NC State's going to grab the ball, and they're going to run back, and they're going to miss that shot, and then Southern's going to grab the ball, and they're going to work it down, and then he's going to post up, and he's going to miss that shot, and then NC State's going to come down, and they've got the ball, and oh no, it's all in his mouth right now. You guys know how it feels. It's all in his mouth. Can I get this back down? Is there more coming? Can I just swallow this and play on? He's got a lot of thoughts going through his head. So Okay, it's still not down. He thinks he can get it down. Okay. All right, he's struggling, but he's got it. Okay, he's good. Nope, not good. Coach, need to come out. Coach, need to come out. Puked in my mouth, can't get it down. More might be coming. Coach, now here's the interesting thing. Why? Why touch that guy? You know you're puking. You're calling yourself off because you're puking. Interesting move to get a little puke on number 0 here. He gets a little puke on him. Number 0, he posts up. He realizes it right here. Like a classic audio soundbite. This is the face of a man who just got puked on. Starting the season off, playing well, having dreams, gonna be good year. Just got puked on, you know? Like, that's a guy that's dead inside.
Now, my goal, Ron, is to present that in Tallahassee one day. Please. So the other thing that we have concerns with is we're starting to learn that, you know, sometimes with some simple things like CBD, it does have interactions with pharmaceuticals, particularly blood thinners and others, and ADHD medications. They bind to the same receptors. And so if, you know, these two bind to the same receptor, if the CBD is working, that means your other medication didn't get to that receptor. And so, and again, going back to what I said earlier, the athletes are not being counseled, educated, and advised by proper medical care. So they're self-dosing. And so they don't understand this. And so we're trying to open up the lines of communication with the staff. But remember, the staff still does the drug testing, the staff or the police. So if I'm an athlete and I'm going to come to the person who actually does the drug test and say, can you help me understand how I should better dose my THC? That's like going to the police and saying, what time should I rob the bank and what's the best way to escape? It doesn't work. And I've even tried to work with teams and say, well, is it possible you can use your captains or make a spokesperson? So if anybody has any questions, there's no judgment. That spokesperson goes up and asks the question. And they said, no, because then they'll judge the whole team. Well, what do you mean somebody on the golf team wants to know about THC? And so this is where I've come in as a consultant because I'm non-threatening to them. I don't do the drug testing. I tell them if you have any questions, you can call me, you can text me, you can social media message me. We'll pick up the phone and we'll chat. And the only things I won't tell you are how much you need to take before you get to 150 and how you beat a drug test. And the rules are, it's whatever you say to me stays between us, unless, you know, the cardinal rule, what you say, I think is going to cause harm to you or others, then of course we're going to tell somebody. But the open line of communication is critical to get them to understand this. I heard in a previous presentation, some talk about vaping. Vaping is so popular right now. And for those of you that don't know, really it's the vitamin E in the cartridges that's causing the majority of the problems. And I try to demonstrate this to the athletes and educate them with images. So vitamin E is a lotion that we rub on our skin, right, to keep our skin soft. And it's actually in that lotion form in the vape cartridges, allowing for the vaporization. So when someone ignites the vape pen to take in their nicotine, their Delta 8, whatever they put in there, they're also taking in a vaporized form of vitamin E. And what we've seen, and you can search this, you'll see some really great manuscripts and even YouTube videos out there that show suctioning happening with individuals have brought into the emergency departments, difficulty breathing from chronic vaping. And when they suction out what's in the esophagus, they're basically pulling out THC, depending on which it was, 8, 9, 10, and vitamin E. Because when vitamin E is vaporized and goes in, it eventually then, under a different temperature, hardens. And how many of you have used vitamin E lotion and you close the lid and then you come back 3 days later and what do you see on the outside of the lid? That little like hardened, crusty vitamin E. That's what's happening after it's unvaporized and it's forming in there. So you have elite athletes and they're sucking wind. They're on a football field for a play that lasts 4.2 seconds and they're coming out gasping for oxygen. It's because as great as condition they're in, they're narrowing the airway significantly. And if you look, these are some of the things that have been found in vape cartridges. And this is completely unregulated, as you know. I've gone undercover to many vape shops, like pretend like I know nothing and just ask them questions. And the only thing they can tell me is, you know, the different flavors they have, the beautiful colors of the cartridges and the holders you can put it in. Do you want one for that lasts the week, or do you want a permanent one, Doc, where you get, they don't call me Doc in there because, but anyways, there's a lot of bad stuff in there that they're putting in their system, and we're just trying to educate them on them. Understand this, what I've never said. I never tell the athletes don't use THC or CBD or anything else. I just educate them. They're adults. They make their own decisions on what they need to do. And so this is an example. This is actually my own vitamin E. I took it out of the jar and left it to sit there for a few days. And then if it actually vapes and gets down through the esophagus, then it hardens on the outside of their lungs, and it leads to what's called popcorn lung in many cases. You may have seen this before. It had nothing to do with popcorn. This was initially found not too long ago, a couple of years ago. It was published in a study where a number of individuals who were chronic vapors that worked at a popcorn factory developed these conditions around the same time. So again, let's try to educate them. I'm going to skip through that as I mentioned it. The other thing we're learning, I don't know if any surgeons in the room here, there's a number of highly qualified publications that are out there that show that individuals at high levels of THC in their system, it's more difficult to put them asleep with local anesthesia, general anesthesia, I'm sorry, and even harder to wake them back up. And they potentially have up to a 3.5 times higher chance of having a cardiovascular accident afterwards. And nowadays, when you're in the OR, oftentimes, you know, the anesthesiologist will come in and ask you, do you have any marijuana in your system? And I just tell the athletes, like, there's no drug test here. This is not the time to lie. Like, let them know it's in your system. It's fine. Now, they're professionals. They're going to be prepared for it, but it's nice to know that ahead of time, put them on alert. And then the other thing that I don't have to tell anybody here as well is the difference in the strength of the THC that's out there today, which is very, very different than certainly when I was growing up. And we didn't see as much. We're seeing cases of psychosis now with some of our student athletes because they're really frequent users. And so we do talk a little bit about the cannabis use disorders and just explain that to staff and look for awareness signs, and to not encourage them to do a crash diet. Anyone that we're talking to, there are cannabis withdrawals, and they're very uncomfortable for some of these individuals. And remember, they still have to perform daily on a high level from an athletic performance standpoint. So there is a process of just helping them reduce, right? Not crash diet. I mentioned earlier about the predictors of academic achievement. We talked to the athletes and the academic staff more so about just understanding that it's behaviorals, it's sleeping in, it's not going to class as much, it's missing assignments, it's more things like that versus just having a bad grade or failing a class. This is another thing we spend a lot of time with talking about right now. I hope someday soon we can figure this out, but watch the video on the right. So I'm on a university campus. It's dawn. I'm waking up. I leave my hotel, which is on campus. It's 2 blocks to the football facility where I'm meeting with the team this morning at 8 o'clock. 1 block away between is the stop sign. I sit down on a little stone wall and take my camera up, and this is what happens. Okay, so in 15 seconds, random, 2 cars roll through a stop sign. Anybody here ever roll through a stop sign before? Run through the yellow light that turns red, and you're looking while you're doing it, and you see it turn red, and like, oh, shit. Speed. We've all done this before. We've all done this. And what I try to explain to the athletes is, unlike alcohol, where we have a certain test with a limit that we know has been deemed to create impairment and leaves your system 24 hours later. It's very different with THC in your system. You cannot put anything in your system for 2 to 3 weeks. And depending on how much you had, when you get pulled over that day, if they smell something on your clothes, on your breath, something in the car, or they just want to profile you, quite frankly, and they test you and you have THC in your system, you know what the threshold is for driving? 0. You're DUI'd. And when I show the athletes is what that means in terms of money, legal fees, driving classes, all those other things. And that's not a good position to be in right now, obviously. So it's more, again, I'm not telling them not to do it because they know the acute effects of marijuana while you drive, but this is even the chronic effects of how this will impact your life. And you're looking at almost, in some cases, up to $10,000. And of course, a lot of bad PR, especially if you're at a more high profile institution. This is a case of individual that literally, he transferred from Georgia to Alabama, basketball player, transferred. The week he transferred, I was in Tuscaloosa working. And that very night down on Main Street, he was pulled over and they had suspicion, they smelled marijuana, they tested him, he was positive. And so even though he transferred universities, the next morning, the press conference said he's no longer part of our team or our university. So it will ruin people's lives and careers as student athletes in these cases. There's a certain extent where everyone's looking for high character people. There's another extent where if you're really, really good, we're going to look past some of this and try to educate you. And everyone and every school is different. But the reality is this isn't going away. And at least like, for example, in our rehabilitation world, CBD products are marketed everywhere. They're marketed in the creams and the topicals we put on people. They're inside the neoprene sleeve knee braces. They're encouraged to use with the tools that we use to do massages, use this special cream, it's better. And none of these are vetted out. They're marketed, they're highly promoted, and we see them in all the conferences we go to. And our people, quite frankly, just aren't educated. It's like a lot of other populations. It's not what we've learned and studied, but it's here. And so we try to educate them. Corey will talk more about this as well, but for product use, anything that is ingested, like an oil, for example, falls under nutritional supplements. And what we're finding is that the professional leagues and others are leaning towards using an external body. And through their collective bargaining agreements and their contracts, the external body they all agree to use is the NSF. There are many labs out there, as you all know, but they will only require approval of a product if it's done through NSF certification and vetting. And NSF, I don't know what it's like, $10,000. I'm probably misquoting it. $10,000 per product to be studied. And so if you have a line of products, you have to be in this game for the long haul to have your product in front of athletes. And Corey will speak more to this as well. The other thing, how many of you heard of what's called NIL? NIL means name, image, and likeness. Bottom line is, for the longest time, the NCAA did not allow student athletes to benefit financially from who they are. And the student athletes took this case to the Supreme Court, who voted against the NCAA and said, you're making the money here for the university. You're filling the tickets and the concessions and the parking and everything else, and winning championship trophies and getting TV monies. So you have every right to benefit financially. And so now what you're seeing is student athletes that I talk to, they can work with a designer tights store down the street, and they go on TikTok or Instagram once a week and show a picture of them wearing, hey, this is my sports bra. And they can get $2,000 a week for advertising that for a company. Some people can get up to the millions, depending who you are and how much likeness your name has at a university. The companies, primarily CBD companies right now, are all around the gates of the universities waiting for the NCAA to remove CBD from the banned list. Because once they do that, you can see, some of these people on here, just because they're celebrities doesn't mean the product is any good. But they've been endorsing the product, and you're going to see a lot more of NIL opportunities. So this is just a quick question I want to throw out to you, because this is the world that we live in. This is a case study. What would you do? So you have a freshman and sophomore athlete who was suggested and an All-American college football player, more than likely going to be a first-round NFL draft pick, suggested to use full spectrum sublingual oils, and said this is going to help their anxiety, sleep, and focus, and so on and so forth. After using it, that you advise them to, the player's overall performance during that time frame declined. They didn't perform as well statistically, and they lost even their starting position on their own team. So let alone then get drafted, that wasn't happening because they weren't performing. After that person lost that opportunity for a payday, essentially, their agent came back and filed a lawsuit against you and said that it was your advice to use this to benefit. And in fact, the exact opposite happened. Their performance declined. So they're suing you for what that person would have made as a first-round draft pick and sign-on bonus, the prediction of lost wages over the entire term of their career, and lost endorsements. $25 million you're being sued for advising them to use CBD full spectrum product. And this is the world that we live in right now. When the athletes come to us and say, hey, what about this? Is this good, doc? You have to be careful what you say to them. That's why in this last 40 minutes, I've never said I advise them, I educate them. I educate them and they make the decisions. very, very careful with my language with the athletes. So I'm going to finish up with my bold predictions and I'm just the warm up act. I'm going to turn it over to Corey. I think in the next 12 months, hemp products will be exempt from NCAA. You will see a flooding. And I'm going to say CBD, and I want to say CBD only because NCAA, just like the federal government, they have no idea what other things like CBN or CBC or C. You can go down the list, right? They only understand Delta-9 and THC and CBD. But you're going to see this change, and now you're going to see an awful different landscape, significantly different landscape. THC will no longer be tested at all because, as I explained to you, how crazy the championship testing is. They don't need to be in the business. The universities and college programs will seek advisors all over the place. They're not looking for corporate sales. Keep this in mind. As you get to knock on the doors of these universities, these student athletes, if you come in as a salesman, they'll slam the door in your face. As you come in to educate them and ultimately can then show you have a product that's beneficial and can back it up, that's different. One thing I will tell you is you will need a courier or a gatekeeper to get into the system. It's guarded really tight. You can't cold call. You can't randomly show up. You can't email. That happens to them all the time. They ignore it. You need a person who's trusted, that knows them, that can get you in and help them see your product and explain and advocate for you. The schools are going to continue to proceed with extreme caution. This is a landscape like everyone else. They don't really know where it's going. NIL deals, as I said, are going to be big, but more so for hemp. I don't think THC is coming anytime soon. Vaping is, it's not going to get any positive press anytime soon. It's starting to become a real problem in the collegiate university settings with these kids. And we're seeing a lot of negative side effects from this. And I think the athletes are going to start to realize, as I see the player on their left and player on the right have significant side effects from it, that that's not the way it's going to get them to the NFL or the NBA or things of that nature. And this is their identity. They're athletes. They don't want to lose their identity. The products are going to start to change how they look. The more medicinal they look, like a pill, right, something like that, the more likely it's going to be considered and utilized. And then lastly, the cannabis companies, I think, as I mentioned, you need inside advisors to the sport. You need to know people like myself and Corey, because we can call those folks and they trust us. They'll answer the phone, they'll respond to a text, and I'll say, hey, listen, guys, I'm not pushing this, but this is a pretty good thing you might want to look at. And then they're smart enough to do it on their own and make the connection with you all. So I want to again thank Gene and Dana. You guys are awesome. I appreciate the opportunity. And this is my contact information. If anybody, I'll be here for the social as well. We'll do it. Corey and I are going to save plenty of time for a Q&A, but this is my email. This is my website, drjeffkonin.com. My cell number, just don't blow it up and tell me anything negative that you don't like what I said. And my boys tell me I need more social media followers. So if you're on Twitter or Instagram, please follow me. Thank you, everybody. And now I bring to you Mr. Corey Tremble, a very good friend of mine, very knowledgeable in this space. Corey, as I mentioned earlier, works with the Detroit Tigers. The last 2 years, Corey was named a minor league rehab director of the year in all of Major League Baseball. And he's truly a rock star, and he knows this space like nobody else in professional sports. So it's my pleasure. Corey Tremble.
All right, well, that'll be easy to follow. Well, thank you everyone for coming here. I'm gonna basically look at this at a different lens. Jeff and what he does with the collegiate athlete is a little bit different than the professional athlete, because the pyramid gets flipped on its head in professional sports. So I have nothing to disclose. A little bit different than Jeff. So what we're going to look at today is the journey of cannabis in professional sports. But mainly what I want to address is how we talk about this space and how we have communication throughout all of our stakeholders. I think that's a big piece to how we navigate cannabis in professional sports, because we're kind of regulated on some of the interventions, even as a healthcare provider, that we can do. And then we're going to look at the liability and exposure, because every single player we have has an agent, which is a lawyer, and they are very good at picking apart every little thing that happens in their career. So we have to be on our toes as healthcare providers, even in this space. And then I'm going to go over a lot of the things that we see as athletic trainers and physical therapists and even physicians that work with teams and how we kind of navigate everything cannabis. So who am I? Well, a lot of you probably have never met me or know me, but who I am is I'm the medical and rehab coordinator for the Detroit Tigers. So that kind of umbrella of what I do can range from HR duties, such as helping players with their personal insurance, all the way to a 1.5 year long rehabilitation of a UCL reconstruction. So to say that I have many different hats is an understatement. But I'm also a student of Jeff's at Florida International University in the Doctor of Athletic Training program currently. But I'm also the chair of the NATA cannabis related resources for the Athletic Trainer Task Force, which was started by Jeff, and I was a member, and then he was nice enough to let me become the next chair. And then also a member of the MLB Medical Advisory Committee. And the importance of those last two pieces is I'm here to try to help educate and drive a message forward on cannabis in two major spaces, right? So certified athletic trainers and the NATA is the governing body for them. And then obviously Major League Baseball. So we look at everything from helmets to CBD products and how we're testing them and how we're looking at those. So being on those two committees and being in those two areas has really helped kind of form more of an expertise for our players. So how do we get here? You know, that's the thing that Jeff kind of alluded to was before the fall of 2019, it was just, we didn't talk about it. And it's because if we even mentioned it to a player and they tested positive, well, then there were repercussions for that. So players asked us questions and we just said, we can't even talk about it. You know, and as a healthcare provider, especially that person that's trying to help an athlete become a multimillionaire one day, you know, it's a very tough discussion to have when you just can't say anything. You know, it wasn't, hey, what exercise works best? Or, hey, what do you think about this facility to use in the off season? Like, we can have an opinion, we can have a conversation. Well, in this one, between our companies and our governing body of Major League Baseball, we just were not allowed to have that conversation. But it didn't stop the fact that players were utilizing and going elsewhere. And it's like, well, if the player is going to seek information elsewhere, well, where are they getting it from? Is it any good? And that's when things kind of changed in the fall of 19. Sort of. So what happened was MLB removed THC from their drug testing panel. So we still drug test randomly, but it's from Major League Baseball. It's not like at the collegiate level where it's actually in-house. We don't test, the Detroit Tigers do not test their own players. Quite honest, we're not trying to catch our own players. So ultimately, it's Major League Baseball. They're the only ones that are testing. And what do they test for now? They test for amphetamines. That's been a big issue in baseball for a long time. Performance enhancing drugs, so anything that's in the anabolic steroid range or human growth hormone, and also drugs of abuse, they call it. Well, THC landed on that for years and years and years in our drug testing panel. Well, in 2019, they removed it, okay? But that's all they did. They didn't give us any information. They didn't tell us how we were going to discuss this. They didn't tell us how we were going to have communications with our front office, with our coaches, with our players, what have you. They just took it off. They sent out a memo. That was it. Well, that wasn't good enough for me. So I started having conversations in spring training of 2020 with some people at the commissioner's office and said, hey, look, if we're going to make these changes, if you guys are going to do this, well, we got to have some education here. I was like, no, we're still not going to talk about it. I said, well, I got this colleague of mine that I've known for 20 years and he's kind of good in this space. Why don't we have him come? No, we don't want him coming in either. All right. So, you know, I was pretty upset and I had a drag out argument with somebody at the commissioner's office. And this was, you know, probably late February of 2020. And then something happened in March of 2020, which changed everybody's mindset on a lot of things. And this guy got put in the back burner, right? So we didn't really talk about it. We didn't bring it up. We had other fish to fry at that point. So we just moved forward. But in the winter of 22, you saw what the NFL did. Okay. They're looking at pain and they've actually created a task force for that and to see if chronic pain, especially with their former players, that's where of all the sports, the retired player in the NFL has really had the biggest issues with their life after sport. So they were awarded $1 million in research grant money. So now you can pick it apart and see if it was a good grant, bad grant, or what have you, but it's still, we're moving the needle, right? And then in the in the fall of 22, this is when things really changed in my world, but also it really kind of helped fast forward for a lot of the other sports. Major League Baseball They partnered with Charlotte's Web, a CBD company out of Colorado, as their official CBD provider for Major League Baseball. So now all of a sudden it went from an argument we're not going to talk about it to, oh, we are really going to talk about it. So now all of a sudden we're having more and more conversations. We're having our league meetings. We're having interviews. And now being interviewed by Charlotte's Web for Major League Baseball's network and being put on TV in a spot and all this kind of stuff. So I went from being a guy with a bad idea, don't talk about it, to now all of a sudden I'm on TV for Major League Network. So it was a big step forward. And then you saw what happened in the NBA recently, where Jeff kind of alluded to that as well, where they've taken it off their testing list, and they've also allowed athletes to receive endorsements in that space. Now, that's not the same in baseball and the other sports, but you're starting to see this snowball effect happening with all of the major sports. And then we started having products become certified for our athletes. So now, again, one can argue if the process is good or the product is good or effective. But at the end of the day, this is what we have to live with. This is what we have to work with. So this is all pulled from, I made this slide in about 25 seconds of a Google search of NBA, THC, or cannabis, MLB cannabis. And these are the first headlines. I mean, this is ESPN, this is Forbes, these are big time media things. So it's not like it's in the shadows. This is all out there for everybody to know about. And which is a big deal for this to kind of move forward, right? Because if the public is understanding this and seeing this, well, then now we're going to have more conversations, and we're going to be as Jeff alluded to as well, we're going to be the ones that help the trickle down effect of safe and effective cannabis use. So what happened was with Major League Baseball in particular, they shifted from this testing for punishment, and they really wanted to make it more of a prevention and then treatment if needed. Okay, they were looking more at drug use in general, and then also utilizing cannabis kind of got mixed into there, unfortunately, as a mental health issue, and looking at it more in that lens. And the reason for that is, unfortunately, Major League Baseball has had quite a bad drug problem in its history, whether it be with steroids, or most recently we had a Major League pitcher that had an overdose on opioids, and it was a major issue because there were personnel within the club that was supplying that player with opioids. So obviously, anytime Major League Baseball or any of these big entities start going into this pool, they're going to tiptoe very gingerly, because they really don't want to have too much exposure. So what you saw was all four of the major sports, NFL, NHL, NBA, MLB, they all removed THC from their testing. And at least if they do test for it, like in the NHL, there's no punishment for it. Okay, so they're just changing how they're looking at this. So now all of a sudden, these sport leagues change, and they create these new rules, and they don't give us a lot of direction. So, this slide, you look at it and you go, well, what does this even mean? So in Major League Baseball, there's a farm system or a minor league team. So it's a feeder pool, right, to the major league team. So everybody here knows the New York Yankees and the Boston Red Sox and all those teams. Well, in baseball, there's this feeder pond of other players that are trying to develop into major league players. So for the Detroit Tigers, these are our minor league affiliates, they're called, all right? So you have the Toledo Mud Hens, which anybody that knows MASH probably has seen the Toledo Mud Hens from Klinger, the Erie Seawolves, the West Michigan Whitecaps, and the Lakeland Flying Tigers, which play right down the road. So why is this important? Because, well, Major League Baseball comes in and kind of says, all right, you guys, we're not going to test for this. We're not going to advocate for it. We're not going to tell you to go do this, but we're also not going to give you kind of any direction on how you can talk to your players or what you can do. And here's the issue, because you have players that say they use cannabis, whether it be, THC, Delta 8, Delta 9, or whether they're using CBD products. And these are just areas of where they play, where they can't utilize. Okay, so now you're telling an athlete that is maybe using something for anxiety, and all of a sudden he's going to play, say, our major league team, where Michigan is fine for adult use and for medical use, and now they're going to Texas and they can't use anything. Well, what does that change to that player? Now, That doesn't mean it's good, bad, or indifferent. It just means that these are the challenges that we face because a player then can maybe move to Toledo, Ohio. Unfortunately, they get sent down from the major league team. Well, now Ohio, they can't do it, so what are they going to do? And then a lot of the time, the player does not live in the state that they play in. All right. So even a medical card is not really an option for a lot of these players. And 30% of our players are international players. So you have players from the Dominican Republic, from Venezuela, from many of the Asian countries. So you have these issues that really weren't mapped out. And we had to kind of on the fly figure this stuff out. And there's not a lot of people in professional sport in general that have a real good grasp of this space. So there was a lot of questions in trying to just navigate how we were going to have these conversations. And I want that to be very clear that this is always about a conversation about education. Okay. This is never about advocacy. This is never about you should do this or you shouldn't do this. All right. This is all players coming to you as a trusted healthcare professional and asking questions. And gone are the days where you could just hide behind saying, no, we're not going to talk about this. Now you have to be able to talk about it. So how do you talk about it? Well, for us, which is a little bit different, as Jeff mentioned, for Alabama football, Coach Saban's the top of the pyramid. All right. Everything goes through Coach Saban, and there's no difference, or there's nothing done or said without his approval. Well, in the professional sport realm, it's a little bit different. The player runs everything. Okay. Basically, there's no other profession or business, I think, that has the lowest educated person being the most wealthy in the room. So when an orthopedic surgeon who has 50 or 20 years of experience and 10 years of schooling walks into a room, he has to hang up his I'm the toughest guy in the room with the biggest paycheck when he's talking to a 25-year-old $50 million a year player. So it's a very odd situation that we find ourselves in. And from experience, I will tell you, when you have a player that might not have a wealth of understanding and knowledge and have a lot of money, the word no doesn't come up in their world very often. And they pretty much are the ones that run the entire system in their world. So what we have to do is we have to create this player-centered approach to communication where everybody that's involved in that player's life has an understanding of this space to then push the message forward on understanding. Okay. So the stakeholders that we deal with the most are the league. So that would be the NFL, Major League Baseball, team ownership. Okay. That is, I will take that back. That is the one person that's more wealthy than the player, is the guy paying him. But there's only 30 of them per league. So there's not a ton. And then leadership, because then there's also front office and people that make the decisions for the team on a day-to-day. Coaches, so they have different responsibilities and different messages that they have with the player. Medical, like myself, but there's also a far-reaching umbrella of what medical is. So you have now physicians, athletic trainers, physical therapists, even dietitians, and massage therapy gets lumped into medical umbrella as well. You have the mental health and skills. So now this is a big business. Not only is the mental health side of it, psychiatry, psychology, but also now you have people that are working with our athletes to help them on a day-to-day basis with their performance. And then agents, reps, and players unions. So these are the people that are going to be diving into everything that it revolves around the player, and they always have the player's best interest, and they really don't report to anybody else. And then also strength conditioning, fitness, and performance science is a growing field in all professional sports trying to get an edge. So when you look at the league office, you have Major League Baseball, you have the NBA, you have the WNBA, all of these different leagues. Okay, so they have a commissioner's office. Most of them are housed in New York City. And the majority of them have what's called like a health and wellness division or a health and safety. And this is what's going to have drug testing policy in it. It's going to have, for Major League Baseball, the alcohol and marijuana use piece is going to fall under this. You saw it in 2020. Most of these were highlighted with COVID and the rules and the regulations and the testing that we did to keep baseball going during the summer of 2020. So there's many different needs for each one of these stakeholders, but the main ones that you see at the commissioner's office level is they always want positive PR. They always want their league and their shield, so to speak, to be looked at in a positive light. Okay. And also it's a $1 billion company. Each one of our four major sports are all $1 billion companies. So a commissioner is really a CEO of a $1 billion corporation when you really just boil it down. So they're going to ask, people, experts, people in our medical space, why should they even enter into the cannabis space? Well, when they brought that to us in the beginning, it was like, well, we're already here, right? These players are already utilizing cannabis on a regular basis from the high school, college level, all the way up to the professional level. So, I mean, you can continue to pretend like it doesn't exist, or you could, get in front of this and drive the narrative from your office down. And they started doing that. And that's what we've seen since, becoming partners with a CBD company and really starting to trying to change the narrative. But also they realized that there was a pretty good benefit financially to this. And anytime that you can have something that is positive PR in the news and also help, the league move forward financially, that's where that ended up. So ownership and team leadership. What you have here is the owners or the ownership group, and then you have your front office, so your GMs, your presidents, and those in the club. So they're looking to put the best, most effective team on the field, but they're also looking for corporate sponsorships. So they've got to come up with the money to pay these players, and it doesn't just come straight from ownership's pocket. So they have to do corporate sponsorships, and they look for ways to drive up revenue. So they look at it from a bunch of different lenses as well. So they're going to ask us, questions like, hey, well, why should we look at cannabis? Well, first off, it's quite a lucrative area to try to get to try to get corporate sponsorships in. So you start seeing teams. Now, with that being said, a team can go into a corporate sponsorship with somebody, and it cannot be approved by the league to use for our players. So it's a very interesting system that ownership can have, because they can start putting on a billboard out in left field, a certain company, and those products can't be used by our players. But also to understand that when we talk to ownership and we talk to front office, is we have to be on the cutting edge of what's out there. Now, that does not mean, again, that we're advocating for the use of any of these products, but we have to be in the know. If it's no different than any other modality that we use, if we don't know a machine that a player uses in the off season, or we don't know a technique that a player utilizes on the side, well, then we're not doing our job. We have to be ahead of the curve. We can't be on it. So coaches and field staff, they have the direct oversight of the team. So that's going to be your coach, the manager, the assistant coaches. Now, what's a little bit different is they have a ton of power at the collegiate level, and they have some power at the professional level. Now, they will make the lineup, and they will help with player acquisition, and they will do a lot of those things. But again, the player runs the show at the professional level. So what they're looking for is they're looking to put their best product, and they want the support staff, people like myself, to put their players in the best position to succeed. Well, that's sometimes through having these conversations and educating them, because there's a lot of old school, as they say, coaches that don't really want to even talk about this, because for the majority of their professional lives, they weren't allowed to. So now all of a sudden, somebody's coming in and telling me this that might help our players, or it might be a route to have a conversation with our players. So that's one of the biggest pieces here. And I will say, the nice thing about at the professional level with coaches is it's not like the movies where the coach says, trainer, shoot that knee up and get him back out there. It doesn't happen. No, they're more conservative than we are as sports medicine professionals for the most part. So if we tell a coach that a player can play the next day, they'll probably give him that day off and play him after that. So it's a little bit different. They will hide behind us, which is good, because they don't want that responsibility or in our world, the liability. So the medical staff. So this is where it gets very interesting, because you have people like myself that is very interested in this and want to have this conversation. There's others that want nothing to do with it. They just want to continue doing what they've been doing forever and ever. And I'll give you an example. I had a call from somebody with another team 2 weeks ago, the exact same position as mine with another club. And he said, well, we were talking to Dr. So-and-so, and he said that, you know, you might be someone to call because we have this player with bad elbow pain. And he said, you might be someone to talk to about weed gummies. That was the exact quote. And I said, well, I don't know if I'm that guy to talk about that, but let's have a conversation here. And then so, you know, I'm educating people just like myself that have been doing it for the same amount of years because it's just a subject that was so taboo that it takes a little bit of risk to even dive into it to learn it. And then you have physicians that, you know, if a team physician has been around for a long time and has seen some of the substance abuse, well, they might just lump this in. Okay. And that's where you have concern, where you almost have to educate your team physicians at times on some of the efficacy, and especially if they're going to be asked that question as well. But at the end of the day, and this is what I tell every one of the athletic trainers that works under me, the team physicians that work with me, physical therapists that work under me, at the end of the day, we always have to remember that by educating, we, you know, lower our exposure as healthcare professionals, but by advocating in our space, sometimes we increase the liability. So you just got to be very careful and very knowledgeable, at least on the conversations that you're having as medical professionals. So the performance and fitness staff, this is in our world, it's actually a lot of the times the first line of defense for supplements, because this is where your creatine, your proteins, your vitamins, everything that a player will take as a supplement is going to be run through the strength conditioning departments most often. Okay. So these products that are approved by the NSF, which Jeff mentioned in his presentation, these are products that the players are going to come to the strength conditioning staff about. So they have to understand that, you know, what these products are. And, you know, these a lot of the times the players will come to us or the strength conditioning coaches because they feel like there's just a little bit more trust. Yeah, we work for the front office, but we're not as connected to the front office as maybe a coach or somebody else is. So, you know, the message that I give to performance and fitness staff is always just, you know, lean into the governing bodies, your state, your league, et cetera. Just, you know, play it safe. Don't give advice when it's not something you should be giving, you know, especially as a non-healthcare provider. And luckily enough, MLB and the other sport leagues have taken some strides, and we can argue if they're good, bad, or indifferent, but they've taken strides to at least allow you to have that conversation and give, you know, education that's not going to come back at you. Mental health and mental skills. This is an interesting one because a lot of the time we have our psychiatrists, psychologists on staff that work as our EAP or employee assistance program directors. So these are the ones that are helping our players in mental health crisis and mental health episodes. So what happens is a lot of them are well-versed in substance abuse. And again, they kind of blend all of this together and they don't see it as different. They don't see it as maybe an option, or they get very defensive and think, well, like, you know, if the player is going to take a CBD product to help with anxiety, do I even have a job anymore? Am I even here to help? And of course they are, right? You know, we're never going to use a supplement or any kind of medication at any level versus the clinical exam or, you know, the use of a healthcare provider, you know. So that's the conversation we have to have with them, is that, look, this is a space that you have to be a little bit knowledgeable in. It's okay. Don't be defensive of it. And it's also not something that we're trying to take your job. And, you know, this is not to replace you as a healthcare or as a mental health provider. The players rep or agent and the players union. So this is somebody that really the only main stakeholder is the player, right? That's the only one they care about. They don't care about the team. They don't care about me. They don't care about anybody that wears a logo but their player. And they work directly for the player. So that's the difference, is that the player pays them and then they listen to them more, but the team pays the player and they listen to us less. I don't understand it, but that's kind of the world that we live in again. So they're always going to be looking for an edge, but they're never going to take liability, because most of them are lawyers. So they're going to be smart about it. They're going to say things like, you know, hey, yeah, one of my players with this other team, he does this, this, and this. And I mean, I'm not telling you what to do. Ask your guys, but like, my other players are already doing this. So it puts us in a bind because that's how they present it to us, right? And they say, well, Billy from the Minnesota Twins is doing this, my agent said it was fine. What do you think? And then we look like somebody that's telling them no. And as you remember, they don't like to be told no. So just making them understand that, look, as the player agent or as the union, we're all here for the same goal. We're all here to help the player and make the best decision for themselves. Okay. So we're never going to be against the agent, although that the agent sometimes feels like, or wants to be against us. We try to make it known that, hey, look, we have the exact same stake in your player as you do. All right. So let's make sure that we're all on the same page. And then finally, you get to the player, the center of the maze, right? Again, the wealthy guy in the room or the wealthy gal in the room that is running the show. Okay. The thing that is always fascinating to me is, the needs. I put this line that happens all the time. It's, hey, I take this product. What do you think? Versus, do you think I should take this product? So they're not asking us all the time our advice or opinion on something they're doing, whether that be a protein, whether that be a CBD, whether that be a medication, what have you. It's always a ready, fire, aim approach with professional athletes. So you have to sometimes kind of peel back the onion and really find out where the need is at and really just start talking to the athlete. And that's where the communication kind of plays out. And, when the player asks us these questions, when they find out that no longer, tested for THC, so I can smoke and I can do this and I can do that, it's like, okay, what I like to do is I like to hold court in the training room or my office or wherever with whatever athlete or athletes we're having this conversation with and try to educate on the entire space. One-offs just always get mixed up and messed up. So explaining the whole thing and not really diving into one specific question seems to be a better avenue to go down than just saying like, yes, no, yes, no. Okay. So trying to give them the Cliff's Notes version of this entire space as best we can. And so that they can make the best decisions for themselves. Because again, these are adults and they're very wealthy adults and they like to do whatever they want to do. So they're going to make their own decision. They're sometimes looking for validation. They're sometimes looking for permission. They're sometimes looking for our opinion. But at the end of the day, they're going to make the decisions they want. And as you all know, you see plenty of news stories where they make poor ones and some where they make very good ones. So ultimately, it's our job just to kind of help that conversation along and maybe steer them in a better direction. So the governing body that professional sports falls under is the NSF and this little label right here, the Certified for Sport. So this is if the product doesn't have that little sticker on it, we tell our athletes don't take it. So if they come up and say, hey, I got this Konin cream, what do you think? Well, does it have the sticker on it? No? Okay, I wouldn't take it. Well, I know 3 other players that take it. Hey, that's their call and that's your call. But I'm telling you as a member of the Detroit Tigers organization that I am telling you I wouldn't take it because it doesn't have that certifying label on it. As of May of 23, so there are 23 products currently containing CBD that are certified by the NSF. Now, so the certification is a little bit interesting because it more so certifies what's not in it versus what's in it. All right. So now, although it is going to look at everything that's in it, the reports that they kind of print out and a lot of these companies show is what's not in it. They want to show that there are no steroids, there are no human growth components, there are no amphetamines. So you start seeing these reports, and instead of seeing like a true cannabis product where you would see how much CBD is in it, how much CBN is in it, how much CBG is in it, you're just seeing what's not in it. And it's like, well, okay, at least I know they're not going to pop positive on a drug test, but that's not really helping the conversation along. But again, I don't make the rules. I just got to live with them. And there's 10 companies right now that are utilized or can be utilized by our players with those 23 products. Now, what's interesting is the NSF, although they say they can do it and they are able to, up until recently, they haven't done any sort of certifications on topicals. So a player that comes in and says, hey, I have the CBD lotion, can I use it? And it's like, well, no, because it doesn't have the label, but I don't know where to steer you because there's none that do. So they're actively trying to get a few products through. And I've been told that it's coming in the next couple of months so that we can have, CBD products on the counter. And I think that will be what we see. We'll see, icy hots and Bengays, and then you'll see CBD on the training room counter for a long time to come. And I think what you're going to see also is those topical companies start adding CBD like you've already seen. So I think it's just the next step. What's interesting too is that you always have to remember that what you're playing under as an NBA player or as a NHL player or even an MLB player to some extent, because they kind of take it in and take it out of the Olympics from year to year, from cycle to cycle. But especially NBA players and NHL players, you got to remember that the rules that you play under in your league are not necessarily the rules that you play under internationally. So you got to make sure that you have that conversation. So if you know that somebody utilizes marijuana on their day-to-day and they're going to play in the Olympics, that's a conversation you have to have, because that's WADA, that's USADA, that's some of the other governing bodies that don't have the same drug testing policies as we do. And then most of our sports are going to be international. They go to Canada, they go to Mexico. Now the NFL, you see, goes to London. They're going to go play in Spain. So you're seeing in Germany, you're seeing a bigger footprint for a lot of these teams to go on. And obviously, like you can't even travel with CBD to Canada, legally. So these are all things that you have to be aware of as the healthcare provider to make sure that you're, ahead of the curve on all of this, so that when the team asks you these answers, you don't go, well, let me get back to you. You already know. And then again, a player that comes from California or from a state where they have a medical card, well, we have to remind them that when they're in Florida for spring training, so to speak, for those 6 weeks, that it doesn't transfer over. It's not because you have a card in Georgia that you can go do it here. So you just got to be, very smart with that and explain to the player ahead of time, because yeah, as much as it's probably like, it just makes no sense to a lot of people in this room, that those are the things that players just kind of don't realize and just kind of glance over. And then when you look at our liability at the professional level, you got to stay within your scope and your knowledge. It's easy, for a long time, it was always easier to say nothing than to learn. And now it's unfortunately the player of today, whether it be in any of the sports, they want information. They have been given information at the touch of a fingertip for basically their whole lives. So they need information right away. And if you don't give it to them, they will find it elsewhere, and it might not be good. So the whole, I just don't want to get into that. It's just not a conversation for me. It just doesn't exist anymore. And you know what? You're still going to be held accountable if something goes wrong, because ownership is not going to want to hear, well, his agent told him that, or his buddy told him that. Well, what are you doing? You're the head athletic trainer. Why aren't you the one, repping or making sure that this space is well communicated? And that's where you have to know the rules, restrictions, laws, and guidelines. So you have to know your state, you have to know your league, you have to know your city, you have to know everything that kind of goes into it. And then also, like I said in that slide earlier, you have to know where you're going. If a player is going to travel on a bus versus a plane, we have our own private plane that we use. But if your team doesn't use a private plane, what does that change? Customs, all that kind of stuff that, players they'll get to the big leagues for the first time and they'll go to Toronto and, oh man, I'm going to bring back a bunch of Cuban cigars and I'm going to bring back all this other stuff. Well, I mean, there's rules and laws that you have to be very careful for, even when you're flying on a private plane. And again, I can't stress this enough. Anytime we talk about this in our space, it's education, 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 not advocacy. Okay. And to me, who's more of an advocate, so to say, in this space, there's other people that are not. And that's why you have to put away your opinions and your bias towards this space and just educate with what we know and what we're trying to explain to our players. And then have to realize that there's still plenty of people, especially in athletics, that have the say no to drugs mentality and don't see this any different. So again, it's just trying to have that conversation, breaking down some of those walls. But the major thing that we always tell our players, every time I have this conversation, no matter when, no matter where, no matter how. It's remember, you are fully responsible for everything and anything you put into your body. It's not my fault. It's not coach's fault. It's not the front office's fault. If you put something in your body that you're not understanding what it is and something adversely happens, that's on you. You have to understand that. So that is the main battle cry that we always say. You are responsible for everything and anything you put in your body. So the main takeaways is there's been a huge change in, the message and mindset, which has opened up this area for education. It really hasn't changed what may have been going on before, what's going to be going on in the future. But what it has changed is it's changed the ability to have this conversation. And I think that's very important. And with our players and with our staff, it's funny because they don't care about the science. They don't care about the scholarship and the research and the literature that's out there. They really don't. They want to know, can it help me? And, really, is it safe or can it hurt me? That's really what they want to know. They want to know if by doing this or that it's going to benefit me on the field or not, or if it's going to take, money out of my wallet. And that's at the end of the day, the biggest piece for them. So you got to always remember to meet your stakeholders where they're at, what they care about and what they really value in the conversation. Different roles are going to have different conversations, like I just kind of mapped out. When I talk to my vice president about, a player, it's going to be different than when I talk to a coach or another athletic trainer. It's similar to when I speak to a physician, and when the physician speaks to a player, it's going to be a much different conversation. The terminology is going to be different, and this is no different. But I will say the literature and scholarship that you all do and drive has helped us have this conversation, because now we're more educated. So keep up the good work, and I appreciate you guys for doing what you do, because now we're able to have more than just opinion or lack thereof. And always lean on the governing bodies, and really, when in doubt, just revert back to that. And again, I can't say it enough: educate, educate, educate. So I want to thank a few people for this opportunity. Obviously, Detroit Tigers and the Professional Baseball Athletic Trainers Association, Major League Baseball, Jeff and Konin Consulting for really, lighting this fire to get me into this space, and then FIU. So this is my information. If anybody wants to reach out or have any questions, love to address them. Thank you. Want to moderate?
Yeah. No. Great. Thank you, Corey. Great job. So I think we have like just under 15 minutes. The only thing separating you and the social is this Q&A session. And we're open to any questions anybody has. I don't know, are there microphones, or just yell out? You have a question? Or do you have a microphone? You just gave him the mic. Okay, we'll start there and then we'll just pass it down. You're in charge. Perfect.
Well done. One comment, but then follow with a question. When you talk about elite athletes being challenging patients because when you mention elite athletes being challenging, we would call them patients from our side, not wanting to hear no. I've taken care of a few Royals, which the same thing comes up when they're not used to being hearing no, but they can still circumvent and get from elsewhere. So kudos for you, at least having the questions answered intelligently. But I was curious when Corey was showing the slides of the farm teams, which come from different states, which have different legislation, that's sometimes almost impossible to keep up with the changes in legislations, and professional basketball players like Brittany Griner having her event where she went to the wrong place with the wrong stuff. Do you have patients who are looking for things, who try to direct their own course for which farm team they go to? Is that the way your system works, where they can have some self-determination to the environment that they arrive at?
Not so much that, because obviously all players want to get to the major leagues because that's where the most money is. So not that, but I will say that when they look at the schedule, they know where they're going, So if I have a player that's playing for the Erie Seawolves and they're going to go play the Binghamton, whatever they're called now, in New York, well, they know where they're going, And so I do think that And what they'll do a lot of the time is they will, especially if they're in a state, and I've heard this on, just recently from a player that did it this way. If they're from a state that doesn't have recreational use, what they may do is they may load up their car with product and then ship their car, because how often does a car shipment get stopped by police? And so that's their way of circumventing laws around it. So these are all the ins and outs. So players, as maybe book smart as they're not, they are awfully street smart when it comes to that. So no, I think what it is, I do think they have a good idea of what they need to do when they get to that team, for sure.
And I think it's important to understand that every single person in this room is more educated than any single TSA employee, as an example. And regardless of if you have something in your possession, completely legal, leaving one state to another, landing in an airport, TSA employee can do whatever they want. They can stop you, they can confiscate it, they can detain you. And you can argue all you want, but that's their world. And we've been in that situation a lot. I mean, I just spoke in the UK this week, and I'm always tempted to bring stuff over and show them what we have here. And you alluded to Miss Griner, and I have a choice. I can play it safe and not put myself in a situation like that, or I can maybe get some additional publicity and put myself in a situation like that. So you have to be really, really careful. A lot of times what I do when I speak is similar to what players do. I have somebody ship the product for me, so it's not on my physical person, but it's there when I arrive in a hotel or something. And the hotel doesn't open the boxes or anything, but you have to be pretty creative to work around the system. I mean, I did an interview with USA Today, and they asked me, what advice would you have for people to not get in a situation like Brittany Griner did? I was like, well, don't bring paraphernalia through Russia. I mean, they have different rules than we do and different laws, and you have to really understand how to abide by others' laws and be really, really careful. And Corey brought up the point about international, especially with Olympic and amateur athletes, including the ones that I work with in college. They train one way and then they go somewhere else, and all of a sudden they have to change the way they train because they can't bring CBD products into China, for example, for the games, things like that. So a lot of that is education, and it's just being really safe and smart about that, because the laws might be laws, but at the end of the day, it's people who enforce laws, and you just really don't know what situation you'll find yourself in with that. Please.
I just wanted to ask you, Dr. Konin, a lot of your data you presented was on the, I guess, let's say more the negative effects of the cannabis on performance, duration, a lot of different details that were impressive. And yet I do feel that you feel in your heart that it's a positive thing for athletes as well. And you, on the other hand, which are more rehab-based, long-term guidance, I guess, have a different perspective, because he's in the early phase, you're in the later phase. Collectively, what is your conclusion on where marijuana fits for the athlete overall? I guess would be my question.
Yeah, it's a great question. So I wish we could legalize and regulate and remove it from Schedule 1 so we can truly do clinical trials and study and know the answers. Everybody in this room is doing their own clinical trials with their patients, and you're learning from that. And so in the environment that I'm in, we're learning from the data that we have. And as I alluded to when I spoke earlier, the people that I'm working with are not using to be able to perform ADLs and get functioning through a day. They're performing and expected to perform at the highest level possible. And what we are seeing in the data is, for the most part, when they have numbers in their system, and I'm just going to throw something out, over 100 nanograms when we test, we are able to see slower injury healing rates, slower reaction times, memory recall deficits. We are seeing negative effects. I also alluded, though, that everybody's different. And in some players, maybe THC is exactly what they need to reduce some of their anxiety. and to sleep better and to focus better. But they're all self-dosing. And so we're trying to learn through this process how much. And what I explain to the athletes a lot is that if you have a headache and you take 2 500 milligram ibuprofens, your headache goes away, but you don't take 8 or 10 of those. And this is what they're doing when they're self-dosing and just constantly smoking with no understanding. When they say, well, it just helps me chill, I wind down. They might wind down, but the longer term effects of the THC in their system is when we're seeing some of these adverse performance metrics. With that said, I'm incredibly honest with players when I meet with them one-on-one. If I lay out the metrics, look, I had some people, their first round NFL draft picks. What am I supposed to tell this person? Yeah, it's in your system. Maybe you could be better. I don't know. Maybe when you go to the next level, it'll show more deficits in the comparison of that play. I don't know. I don't have all the answers. So I don't know that I would say that I'm negative towards the performance. The numbers that we're overlapping are negative, but I think that's a reason why I emphasize that one case study where it shows it doesn't have to be abstinence. This person lowered it significantly and then was able to make gains. So we're trying to address this. When I speak to a group of athletes, it's like anything else. You hear me, you clap, you whatever, and then it's done. It doesn't change behavior. When you meet with somebody one-on-one and you say, this is your identity, and that's what they live by, promise you. If they're not on the court, on the field, whatever it is, first string, this is their identity on a college campus. When they lose that identity. So I try to explain to them and show them that, you're doing everything everyone else is doing. You're on second string. The only thing difference is you have this much THC in your system and they don't. It's up to you. Do you want to try to see if we lower that amount, if that changes your performance metrics? Completely up to them. So I'm not negative against it. I'm trying to really bridge the gap and figure out. So I don't tell any single school I work with how to test, what metrics to use. They all have their own highly sophisticated wearable technology programs. They measure everything, literally, like what time these guys go to the bathroom, how much you name it. And all we're trying to do is say, is there any correlation to every single thing you're already measuring because you think those measurements are important to THC numbers in their system? So I never use the word catch. As I said earlier, the school said they want to catch someone. I want to identify. I want to identify if there's something in their system. So if there is that, just like if it were blood sugar, low iron, let's do this lab work and find out if anything in their system is impairing their performance when we overlap it. That's all. There's plenty of players that I meet with one-on-one that have it in their system, and we look at their metrics and I can't point to a single thing, and I'll honestly tell them that. So it's a learning curve. I could come back next year and tell you something totally different.
Well, and the flip side of that, and this is what's difficult in my world, is that as much as they test and they have numbers on everybody, we're not allowed to. So at the professional level, everything is collectively bargained between the league and the union of the players. So they have decided that any kind of testing or wearable, especially drug testing, I can't drug test a player ever. And that's because it's collectively bargained, and they have decided to go against that. And that's because they feel that the teams will utilize that in arbitration cases or contract negotiations. So we are in a much different situation because it's really a conversation. The only thing I can have is educated the athlete. I can't show them numbers because they won't let me do it in the first place. So it's a much more different conversation. But to Jeff's point too, is that player that's whole identity is on the field or on the court. Well, a lot of the athletes I work with are getting taken off that for 3, 6, year and a half sometimes. And they're looking for coping mechanisms and everything else. And so you see this, and worse than anything, they have a lot of time on their hand. You can't do rehab exercises all day long. So there's only a certain amount of time that we're going to have face to face with the athlete. And then they're at their own devices when they would be going to a game, or when they wouldn't, be doing whatever with their teammates. They're in the formal rehab setting. So that's where, I wish that I had some of the advantages at the college level of really being able to show, which makes no sense to medicine. I mean, why would you take blood pressure if you couldn't have some sort of intervention and then retest? And yet we can't do any of that in this area. So that's kind of.
And I'll give you two other examples. So last week I was in Chicago and I spoke to the NBA at a performance meeting, and they're in a similar situation. So their medical staff has nothing to do with the testing. It's through the collective bargaining agreement. And if somebody tests positive and fail tests with marijuana in their system, for example, they're not allowed to not only not know the numbers, but not even know that they failed the test. So they don't have this information. They might just find out later, well, the player entered the system or something happened. They're not allowed to tell the coaches, they're not allowed to tell anybody this person tested positive, right? And so you're sitting here guessing. Now, my question would be is, if I am finding that certain levels of nanograms in certain people's systems are impairing reaction time or other things. So let's take Corey, Major League Baseball. If I can show you that X amount of nanograms in a system will delay your reaction time, how does that impact a player who's had to go up to bat and face 100-mile-an-hour fastball or curveball? Are you putting them in a dangerous situation because the information is being withheld from you? So all I do is explain to the athletes. So what would be a warning sign in baseball? If somebody all of a sudden, you know, they're becoming more of a heavy user, and now they're also performance decreasing in certain metrics that would match the reaction time or things like that. You have to almost speculate to a certain extent. But again, we're not accusing anybody. We're just educating and saying these are some of the things that happen. It's up to you to decide. I will tell you this. I mentioned their identity is one thing. Probably the most important thing is money, bottom line. Because their livelihood to make all this money that Corey talked about is in a window of time. It's a window of time. One of the things I also do is talk to parents. So I meet with the parents of these Power 5 schools and I explain to them, because a lot of the kids that we see now, they started their habits of heavy vaping use long before they got to college. And in fact, their parents showed them. They do it when they go home. So all we do is tell the parents, hey, look, we're not telling you how to live your life. You're in a different situation than your son or daughter here is chasing the dream. But I did speak to your sons, for example, and the first thing I asked them was if they signed a contract in the NFL first round draft and they got a $1.5 million signing bonus, what's the first thing they're going to buy? And to a person, everyone says, I'm buying my parents a new house. So I tell the parents, you want a new house? I just need you to help with moderation of what they're doing. Okay, if they use too much, let's just make sure if we come to you and say, you know, it's impairing their performance, that we're all on the same page on this together. It's like Corey said from the beginning. At the end of the day, we all mean the same thing. We want to see the players be their best and perform their best. The problem is we don't have great science yet. So we're trying to track the science down and see what we can learn as we move forward. And we're starting to see it. Unfortunately, as I said earlier, you're not going to see me publish this or tell everybody the details because it's proprietary information from school to school to school, how they're using this knowledge. It's big money. College as well, big money. So we're learning. And I agree with Corey. I applaud all of you in this game. We're all coming from different angles, but we have the same thing in mind. Can this be a benefit from person to person to person? We just happen to work in a space of athletes, and there's different rules we have to follow by and different policies and criteria and things like that. But it's a fun space to be in, that's for sure.
In your experience with people that have concussions, do you follow whether they were users prior? And what is your experience with users versus non-users in terms of concussions?
Yeah, that's a great question. So we've just started to look at that now and go back in the data. And it's an interesting scenario. I'm going to say that I think only thing we've learned so far right now, again, goes back to dosing. There might be an optimal dose that in the future can play, because we've seen some benefits in animal studies, particularly with CBD in animal studies as a neuroprotective agent with concussions. Can it work prophylactically? Can it slow down or speed up recovery? It's possible. It showed that in animal studies. We don't have enough data right now to know the answer to this. We're just starting to look at it. I do believe it's going to come down to dosing though. It's not a one size fits all that you can use this and it'll help your concussion. It's going to be probably a low dose of something. And once we have a better idea of clinical studies, we can understand what that low dose might be.
Do you personally recommend CBD with people that are not users after they've had a concussion?
I'm sorry, can you repeat that?
I said, people that are not users and they have a concussion, what's your approach with CBD? Do you recommend?
So I don't recommend. I stay out.
You
That's-
educate.
Recommend and advising are the same terms that get us in big trouble. They really do. In fact, when I work with all the schools and the teams that I work with professional groups as well. I will encourage them to create educational sheets in writing with a lot of the similar common questions they'll get. And the reason is someone can't come back later and say, well, you told me this. I said, no, we use the same language, the same approach, and here's exactly what we do. So I don't recommend that. I do help people understand that there may be a benefit to that. They need to also work with, in the groups that we have, work with their team physicians. The physicians understand what other medications are on, what other interactions there might be, and other things. Their mental health provider may have them on medications that we're not privy to knowing that information. So we take it from a team approach from that standpoint. So I wouldn't say yes or no. There's some benefit to some people, but it's not a one size fits all. I hope we get there sometime in the future. Gina's walking closer with a sign, and the sign says, oh, 1 minute left, 5 minutes left. I don't know. Well, Corey and I are going to stick around for the social too. So, and, individual questions and other questions, we're more than happy to chat about. Okay, good. Thank you. I don't know what this is.
You will, just hang in there. As I told you before, wealth of information from both of these gentlemen. Thank you very much. I learned something. I sit in the back in the office, right? So I'm the guy behind the curtain, but I'm watching. And I learned a couple of things today about Dr. Konin. First off, I understand that he is the weed guy and Dr. 420. And I learned from Corey that he's the manufacturer of Konin cream. So I'm going to go there. So with that, presented to Dr. Jeff Konin, AKA the weed guy and Dr. 420 and manufacturer of Konin cream, an appreciation for his participation in FMCCE 2023, Dr. Konin.
Can you do your photo? Where's your photographer?
Norbert, can you take a photo?
He really did write this.
I was getting bored back there at the registration desk.
That tells you much about our presentation.